Ambulance workers are launching a legal challenge over what they say is a demoralising about turn on a planned pay boost from St John. First Union has lodged an application with the Employment Relations Authority, claiming St John has breached an agreement to pay weekend and overnight shift rates. St John says it's facing a $30 million shortfall and can't afford the rates right now. And paramedics say they're in the middle of an ongoing funding debacle. And as Nita Blake-Persen reports, they're questioning whether St John is the right outfit to be running the ambulance service.
Talking to media is a big deal for St John paramedics. Interviews are banned under most contracts. But after St John announced it would not be able to pay staff the weekend and overnight shift rate that was agreed to after strike action last year, this man decided to speak up.
Money to help us out for all these unsociable hours would have gone a long way. And people were quite passionate during the industrial action about it. And to be told 3 weeks out that no, we're not going to get it has just been demoralising.
He's been working as a paramedic for the past 17 years and says the affordability issue comes up time and time again, and further strike action could be on the cards.
They're more than happy to take up where they left off. They're quite passionate about it in the first place, and just to be kicked in the guts again and said all that fighting we did, they're just not paying attention to it. A few people are quite angry about it. The morale of all the stations is just bad.
St John, which is 70% government funded, announced last month it needed to claw back $30 million over the next financial year after COVID-19 and the lockdown limited its fundraising. That meant that penal rates, which were agreed to after last year's industrial action and were due to come into effect from the 1st of July, haven't been able to be paid. The charity says the rates were subject to affordability and an independent market review, which has since been completed and advised a different approach. But Sarah Stone from First Union, which represents nearly 1,200 ambulance workers, says that's not good enough.
And so they haven't applied for funding to cover it. They haven't produced any evidence to show that they can't afford it. And so our only option left was to go and file it with the Employment Relations Authority and take them to court and settle the matter in court. You know, members feel it's disingenuous of St John, and they don't really believe that they ever intended to pay the shift pay.
St John pay rates range from $20.50 an hour for the lowest paid ambulance staff to $26.48 for an emergency medical technician. Paramedics get $34.10 an hour. St John says it's been paying staff a 5% unsociable hours shift allowance since the end of last year, an interim measure until the penal rates of time and a quarter were due to come into effect. The paramedic Checkpoint has spoken to says the current funding shortfall raises bigger questions about how the company is run.
Every year they keep saying we can't afford this, we can't afford that. If you're a charity that can't afford it and you can't run it as it needs to be, then maybe it's time you don't run it. And maybe the government needs to step in and say we need to bring this in line with FENS and police and run it as a proper emergency service, not as a charity.
Mark Quinn is an intensive care paramedic and spokesman for another union, the New Zealand Ambulance Association. He says St John are the right outfit to run things, but their government funding needs a massive boost.
I think St John is the right organisation to be providing the ambulance services. When I hear calls of wanting to have a nationalised ambulance service or another provider, it doesn't necessarily mean that the services will be any better, or certainly the conditions will be any better for the ambulance officers.
In a statement, the Ministry of Health said it had given a short-term funding boost to road ambulance providers for additional staffing in this year's budget. That $36.5 million over 4 years was in addition to the $25 million that the government handed out last year to ambulance services to relieve financial pressure. St John says it's begun to implement $30 million worth of cost-saving measures, and the government is acutely aware of its financial position. It says it's hopeful there will be additional support from its funders. For Checkpoint, Nita Blake-Persen.